Dr. Rachael Lovink. I'm a naturopathic doctor in Victoria, BC, and I work almost exclusively with gut health, but in particular my niche is in IBS, so I really help patients with dealing with the chronic illness of IBS. I am also an IBS patient myself, or I have IBS, we call it IBS warrior. I'm an IBS-C. And so my own journey with IBS is a lot of what fuels my passion in this area, and also what gives me that real life, anecdotal, lived experience of the disorder that honestly I think is a huge benefit for the patients who work with me, because it's one thing to know something from textbook and to learn a lot about it, but it's a whole nother thing to have lived through it. And so I really offer that wisdom and that experience to my patients. And in relation to this talk in particular, nervous system regulation, stress support was one of the biggest pivotal moments in the trajectory of my IBS. I did actually just launch a webinar which talks a lot about like the three biggest mistakes and myths out there in the context of IBS. And along that path of my own journey with IBS, accepting my IBS diagnosis was the biggest one, because of course I didn't believe it for the longest time. But then after that, it was really honing in on the nervous system piece. So that's my wisdom that I offer patients. Yeah, and my strategy is really based on my style, and how I support patients is really focusing on the evidence, but offering practical real world application of those tools, right? So it's not just about prescribing a medication or prescribing a diet or a supplement. It's about how do we integrate these things into your life. And so today, in the context of the nervous system support, that's what I'm really going to offer you, is some true wisdom in terms of how to actually apply the tools in a realistic way, not a, quit your job, leave your relationship that you can talk with your counselor about, but more about how we support ourselves on a day-to-day basis. So let's kick it off. It's 12:03. I'm going to just get going a little bit early. Let's first of all start by talking about what is the connection between IBS and stress. And I think there's a little bit of misunderstanding about it. IBS is not caused by stress, although we definitely see some factors related to stress that are risk factors for developing IBS. So we often see in people who develop IBS, we see a history of significant psychological distress. So whether that's having anxiety or depression, or whether that's having childhood trauma, abuse, prolonged periods of big stress, those are often present in people who have IBS. And we don't know exactly why. And obviously just because you have those events, it doesn't mean you'll develop IBS, but we know there's an association. And we can draw some conclusions from that, obviously knowing that IBS is a disorder of gut-brain interaction, right? And what that means is that what happens in our brain, which is where stress starts, right? Stress, well, it can start in your body, but our brain perceives stress. And again, perception is a big piece here, because it's not whether we're actually under attack by a dragon or tiger, it's how our brain is perceiving that stress, can have a massive influence over how our gut functions. And so we know that in IBS, there's already disrupted communication between the brain and the gut. And when we add stress to that piece, or psychological stress, that just essentially disrupts that communication even more. So yeah, and in the context of anxiety and depression, there's a bidirectional relationship. And what I mean by that is that some patients had anxiety and depression along a lot of their life and then eventually developed IBS. But some people have IBS and then they develop anxiety and depression. And that's because of that bidirectional relationship, but also because of the impact that IBS has on your quality of life. And so that can, of course, cause psychological distress, in addition to, of course, disrupting our microbiome, which disrupts our hormones and our neurotransmitters. And so it's this connection piece that's really important. And so one of the biggest mistakes I see a lot of people with IBS making is they focus all of their energy on the food piece, the microbiome piece, right? Chasing infections or chasing SIBO. And they don't really put the time into really honing down on this gut-brain communication piece, this nervous system support piece. So, and that's kind of my journey was like really that turning point when I really decided to like, okay, I need to like get real about this. I've done a million SIBO protocols. I've taken all the supplements. I've literally did every diet under the sun and nothing was sticking. And acknowledgement of that profound impact of the gut-brain communication piece and how my stress was showing up for me. And in particular, what I want to mention here is like, what does stress mean? Because I think when a lot of us think of stress, we think of like, either we think of the big stressors in our life. So like when we feel financial pressure in our families, or maybe when we feel work stress because we have a deadline, or we feel emotional stress because of in a relationship. And that is absolutely relevant. But stress can actually also be, I call it sneaky stress. It's the me type, the A type, the like always busy, always on the go, always, rushing around type of person. Hello, that was me. That is also stress, right? And so we may not feel stress. And I know for me, I didn't, when I was dealing with this, I didn't necessarily feel stressed, but I think it's because I wasn't thinking about stress in the way of like how I was always on the go and always in fight or flight. And a lot of people get used to it, right? And we don't even know another reality because it's just our normal. And stress can actually also feel good sometimes. Stress isn't all bad. Stress is absolutely essential. Our body needs to kick into that fight or flight to like engage our brain and to engage our muscles, and it can actually feel exhilarating, which is why stress can be addictive, and also why sometimes we don't notice it because we can be in that high, that euphoria of stress. But when that's chronic in the context of IBS, it's a huge piece in how it continues to disrupt the gut brain piece. And also we'll learn a little bit about how it disrupts the microbiome and the immune system in the gut. So that's what I mean when I'm talking about sneaky stress is, and I've had so many patients like this were like, well, I'm not stressed. And then when we look at their life, they are the type of person who wakes up, who's like rushing out the door first thing in the morning. They're in an environment where they're really engaged all day, which again, might not feel bad. And actually, of course, we want to be able to be in that state because sometimes our job requires that, but it's that all of the time, right? And there's no rest and digest. There's not enough time for our gut to function properly, which of course, when there's a lot of gut issues, it's really important that we prioritize that. So that's the sneaky stress piece that I talk a lot about. And how I frame this is that IBS is a stress sensitive disorder. So again, it's not caused by stress, but it's very stress sensitive. So let's talk about, just looking at my notes here. Yeah. So as a disorder of gut-brain interaction, let's talk about some of the mechanisms that happen when we are in our fight or flight too much. Again, reiterating that stress isn't all bad. It's okay to be stressed at times, to be in that fight or flight engaged state. But what happens when it's like always occurring, when we're in that state all day? So it can alter communication, so how our brain is perceiving the gut. And we actually see this a lot in patients who have IBS, something called visceral hypersensitivity, where your pain perception, how your brain is perceiving pain in the gut has a very low threshold. And our brain essentially has a magnifying glass on the gut. And so our perception of pain is quite heightened, and this stress just exacerbates this. So pain increases, our tolerance decreases, our sensitivity to pain increases, our gut motility is altered, right? When, I'm sure many of you have had the experience that when you feel stressed out, there's kind of two types of people. We're either feeling the urge to go and we need to rush to the bathroom. That's that like anticipatory anxiety, or we can't go at all. That's me, right? So when we're feeling stressed, it can alter our motility, which can impact how the frequency of our bowel movements and how predictable they are. Chronic stress can cause low-grade inflammation because of the way that it alters the immune system. And this is something we do see in patients with IBS, is there's this like low-grade inflammatory response in the gut, which kind of makes the gut highly sensitive to pain, but also to food, right? And so this is where we sometimes see this intestinal permeability in patients with IBS because of that low-grade inflammation and immune dysregulation. So these are really important pieces to highlight, because when we talk about treating IBS and how we get people better, these underlying dysfunctions that I'm talking about are core to why you have symptoms. And stress is something that will continue to perpetuate it. So no, it might not be the thing that causes it, but it will perpetuate it. It also disrupts the microbiome. So we know that in patients who are chronically stressed, it can alter the microbiome negatively. And IBS is already a disorder where there's dysbiosis, which means there's an imbalance of bacteria. And so we then throw stress, chronic stress into the piece, and it just further dysregulates that. So I hope you can see now why stress can have a negative impact on an IBS gut when it's chronic and unmanaged. So let's talk about why we skip this piece. Like, why does it feel so hard? And I think, certainly from my own experience, stress can feel like one of those things that feels intangible, right? It's something like I was talking about earlier. We feel like we have to get rid of these big things, the financial, the relationship, the work stress. And so it can feel, we kind of can have this F it mentality. I'm just looking here. Yeah. Where we kind of say, well, I can't change it, so whatever. I'm just going to keep going. Sorry, I'm just looking here what this notice is about. Someone was just trying to join. I don't know why they couldn't. Yeah. Okay. So it can feel intangible. Well, I can't change it anyway, so, whatever. And I think we've also been led down a path, right? Many of us, if we're on social media, we've seen other practitioners, is that the focus is always on the food. And we are, there's just a hyper focus on food. And so we ignore the stress piece. So I think there's an overemphasis on things that are not related to stress, which can lead us down these paths. And so the stress piece gets ignored. But the reality is, it's something that's super important, and it doesn't have to be the getting rid of the big things, right? There can be tangible ways that we can support your nervous system on a daily basis. And that's what we are going to talk about today. So before we dig into the tools, which don't worry, I'm going to get to this, and please ask questions if you guys have any. I would love to hear them and address them. But let's talk about what are some of the sneaky ways that stress can show up. So sneaky ways that stress shows up, other than the big things, would be rushing, right? So I talked about this. That's type A person, or this busybody person. So we're always rushing, constantly on the go, kind of no downtime. That's a sneaky way. Obviously eating on the go and rushing eating. So those are other sneaky ways. Ignoring your hunger cues. And this is a really big one. So sometimes we get so busy in our days that we actually are not in tune with our body's basic needs. So I'm going to group this with actually even ignoring the urge to go. So whether that's urinating or having a bowel movement, a lot of us are so out of touch with this that we don't even know that when our body has the urge. But as we attune more to our body's basic needs, this is also how we regulate our nervous system. So sneaky ways that we dysregulate our nervous system is by ignoring our urge to go. When you have to go pee, do you hold it because you're in a meeting or you're busy? Or when you're hungry, do you suppress it because you're I don't have time to eat? Those are sneaky ways that absolutely dysregulate our nervous. Yeah, high pressure jobs. These are obviously easy ones to pick out, but just time pressure in general. If we don't constantly feel under the gun, under pressure, this is something that can absolutely dysregulate our nervous system. Then there's the social anxiety, the anticipatory anxiety. So for someone who has to travel a lot for a job, or who maybe has to be socially engaged, but this can cause some stress for us, and maybe you're aware of it, maybe you're not. Some people suppress that. Poor sleep is a huge dysregulator of our nervous system. We feel crappy when we don't sleep, but also our nervous system is way less resilient. And so this is a major sneaky trigger for IBS symptoms, is poor quality or inadequate sleep. And yeah, I kind of moved through the basic ones. So what happens when we start regulating our nervous system? How's that actually going to show up in our IBS symptom improvement? And I have seen this with my patients without touching anything else. So without doing the diet piece and without using supplements, I have seen the transformation, and I have seen it myself, of what happens when we actually start regulating our nervous system. We have fewer flare-ups. So the flare-ups where it used to be happening weekly will start occurring kind of maybe every couple months. And we definitely know the trigger when they happen. More predictable and regular bowel movements. So suddenly our bowel movements are not all over the place. We see more regular pattern to them. We can tolerate a wider range of foods. So again, I've talked about this so much, but if you don't follow me on Instagram, or you haven't been following me, food is often not the trigger. It's often how our body tolerates that food. And as I mentioned, the ways in which stress disrupts our gut function, which therefore creates an environment that's like really conducive for food reactions to occur. And so by regulating your nervous system, you will likely notice that a lot of your food intolerances, your food sensitivities will go away, which is kind of like this miracle work. Not all, but a lot of them. And just overall greater resilience with your triggers. So we notice that suddenly where traveling used to be a huge trigger, that it's not a big trigger. So I think that's massive things to really like look forward to in regulating your nervous system. And this is not magic work. This is real. This actually happens. But of course, consistency is a key. So let's dive into what you can do. Nervous system support for me, as I've talked about in the beginning here, is really about like tangible, realistic ways that we can show up for ourselves on a daily basis, right? Not the leaving the job stuff, not the like all of a sudden making $1 million stuff, but like how can we show up for our nervous system, show up for our IBS, show up for ourselves on a day-to-day basis. I'm all about that. As a mom of a toddler, of running a business and seeing patients, this is like the number one way that I show up for myself and my nervous system. So something I talk about a lot with patients is called micro moments of regulation, right? And so what this is these are like little ways on a daily basis, on a moment to moment basis where you can regulate your nervous system. So this could be as little as like, as we're sitting here, you're watching my presentation and maybe you're feeling tension in your belly, or you're feeling that heart racing, or you're feeling tension in your shoulders. It's noticing that and it's relaxing, right? Letting your shoulders drop a little bit, taking a breath, seeing if you can just release some of that tension. That 20-second exercise of noticing, releasing, relaxing, letting go of tension in your jaw is so powerful. And if you do that on repeat throughout the day, right? And of course, this takes practice of like learning to check in with your body instead of like hammering ahead with your day like a lot of us are used to, but checking in moment to moment. You don't need to like, and I think, right, I mean, I can remember this for myself. When we get into a stressful situation, sometimes we're like, oh, I just need to get out of this. But here's actually something I've really learned, especially we're living with a toddler, having a toddler, is you can't. And so it is about, in that moment, regulating your nervous system, right? Taking that breath, releasing that tension. And you will notice that over time, as you show up for yourself, you tune in with your body more and more frequently, that this will become a more and more powerful tool and you'll start to see its effects. So that is one I love. Yeah, taking frequent breaks as you can. I know some of us have busy, stressful jobs. I certainly get it. Sometimes I'm seeing patients back to back, but it's about even that 1 minute that you can take in between whatever meeting or, whatever you have to do, where you can just take a moment. So, right. So not just going on with your day without any pause. It's about finding those 30 seconds, those 1 minute to take a break. Something I love to do, which I practice almost every single day, at least 2 or 3 times a day, is I'll just go lie on my floor. And I've shown this on my Instagram. Lying on the floor can be exceptionally regulating. There's something about, maybe it's the grounding thing where your body's just lying flat and your nervous system can just kind of like chill out. And I love this, especially if you're struggling with bloating. Just lying on the floor for a minute or 2 can make a huge difference. So that's a big one. Post-meal movement. So like after you've had a meal, some of us will have GI symptoms that show up. And whether that's because you rushed through your meal or you weren't really in rest and digest leading up to your meal, but just getting a little movement in can actually be really regulating for your nervous system. So those are little micro moments that you don't need to take an hour out to do. You don't need to take a half hour out to do. It's literally infused into your day, easy to apply. Number 2 would be routines and rituals. And this is a really, really big piece. It's not something we typically think of when we think of regulating our nervous system, but when it comes to gut-brain communication, what we're trying to do is regulate how they're communicating. And so when I talk about rituals and routines, what I'm actually talking about are 2 primary things, actually 3. The timing of your eating, what you're doing at your eating, and sleep. And so the timing of eating, what I mean by that is what's the frequency of what you're eating? Are you someone who's going 5, 6, 7 hours without a meal? So maybe you're, skipping breakfast, you don't eat until noon because maybe you're doing intermittent fasting, or maybe you have like a small bite to eat in the morning, but then you're not eating until 2 o'clock.
those big gaps in your eating schedule can actually really dysregulate your nervous system, but also dysregulate gut-brain communication. So when I'm working with a patient who has IBS, one of the first things we do is we work on eating at regular intervals. And I usually recommend about 3 to 4 hours. It helps with so many pieces. But in the context of this conversation, it really helps with like providing a bit of safety to your nervous system, right? It helps to regulate blood sugar. It creates a bit of a rhythm with your gut-brain communication, which can be exceptionally powerful. So that would be one. Two is, what are you doing when you're eating? It's super important that our body is in rest and digest when we are eating. So if you're someone who is eating on the go, you're rushing through your meals, maybe you just sit down and you're just feeling stressed because of the day or whatever, finding a way to get your body into rest and digest when you are eating is so powerful. So taking some deep breaths, try not to have any distractions. If you are really sensitive to stress, you might want to like eat by yourself, whatever. Find some tools that really help to regulate your nervous system. But that would be a really big one I would focus on. So timing of meals, what you're doing at your meals. And then the third one, of course, is sleep. Sleep is so important. I'm actually not going to go into a huge, because this is like a whole other conversation. But if you are not sleeping properly, it is going to be so hard for you to regulate your nervous system. So when I have a patient, for example, that comes to see me who is getting less than 7 hours of sleep or, not good quality of sleep, we kind of pause everything else and we address that. It is that important because sleep is just the cornerstone of so much. And if that's not working well, it can be really hard to start to actually see some improvements with your GI symptoms. So yeah, I'm going to leave the sleep piece at that. I guess the one thing I would say about it is give you a little piece to take home is consistent bedtimes, right? If you're someone who's constantly going to bed at different times, or you're a weekend warrior where you're going to bed at a very different time than your weeks, that would be one piece I'd focus on. Consistent bedtimes, consistent wake times. It is one of the strongest ways to regulate your circadian rhythm and your hormone production in relation to your sleep. That's my little golden nugget for that piece. Just looking at my notes here. Right. Okay. Let's talk about, actually, I did forget one piece. So I'm actually just going to talk about quickly a randomized controlled trial, which is a very high level of evidence. And you guys know I'm all about evidence. So what they studied in this one was, it was a 23, so pretty recent RCT comparing standard treatment to stress relieving therapies to improve IBS symptoms. And what they found was that the stress relieving therapies were just as or more effective than standard treatment, which is pretty awesome. And what they actually did in this study was they had patients do regular walking and essential oils. I talked about this at the beginning of the talk. That's it, right? Regular walking, as I talked about earlier, is so regulating for your nervous system. And yeah, I mean, when it comes to exercise in general, this is a tricky topic in the context of IBS for someone who's really struggling with a lot of like flare-ups and a lot of GI disruption. And if this is someone who's also doing a lot of high intensity or prolonged exercise, right? So maybe you're going out for very long runs, an hour, hour and a half, even maybe beyond 45 minutes every day or quite frequently, or you're doing a lot of high intensity exercise, this can be very challenging for your nervous system because although exercise is amazing, and I'm by no means discouraging exercise, depending on where you are with your IBS, there's a time and a place for it. So high intensity, prolonged exercise is not something I usually recommend for patients in the early stages of their IBS treatment, especially if there's a lot of like stress, nervous system dysregulation. So what I focus on instead is walking is so regulating for so many aspects of our health, but in particular with your nervous system. If you're feeling anxious one day, if your GI symptoms feel like they're flaring, try going out for a 15, 20, 30-minute walk and just see the magic that works. Again, it's not going to fix everything, but it's all these little tools that we add in. Unfortunately, with this study, I don't know which essential oils they used, but I thought that was a pretty cool study. Right. So we talked about the rhythms, building rhythms, and the last piece I want to focus on, which I've already touched on a little bit, is about attuning to your basic needs. Now, this is something that is underemphasized, but is super important when it comes to regulating our nervous system. And it can take some practice and some practice with like tuning in and checking in with our body more regularly to actually start to notice and be aware of these things. And I talked a bit about it before, but it's about going to the bathroom when we have to go to the bathroom, right? Not ignoring the urge. It's about eating when we're hungry, resting when we're tired. These like basic ways that we can attune to our body's basic needs is how we build trust and how we regulate our nervous system. So it's not necessarily easy, right? It takes practice and it takes consistency, but I find that the more my patients attune to these, the more they actually start to notice them, and when they actually might notice that they were ignoring them for a long period of time. So that is a very helpful tool. And I guess how easy, I mean, it's not like we're leaving our job, but I think it is in the relatively speaking, a powerful and relatively accessible tool that you can do on a daily basis. So let's talk about some other tools. And again, these are maybe a little bit more advanced, but just want to put those out there. Gut-directed hypnotherapy is something that can be very helpful. And there are online versions of this, whereas you used to have to go see a therapist. There's something called NERVA, which is gut-directed hypnotherapy. It's a 6-week program. Very helpful for regulating nervous system, gut-brain communication. It's not for everybody, so probably check in with a practitioner first before purchasing the NERVA app, because there's some people who I probably wouldn't recommend to yet, but that's definitely something to think about. Time in nature, right? I've talked a lot about this. I love, for me, forest bathing is super helpful. So that's something to think about around the nervous system regulation. Nature has a profound way of slowing us down, right? Making us aware of our environment, of, paying attention to the sounds, the smells, the sights can be very nourishing. So that's something that's very easy and accessible. I wouldn't necessarily call it a more advanced tool, but that's something else I think about. Community and emotional connection. This one is really big too, right? And I know it may not be accessible for everybody, but spending time with loved ones, having community, having people who understand you, who you feel you can be open and transparent with, can be very regulating for our nervous system as well. So those are my go-tos. Yeah, I think I'm going to stop there. That's been about a half an hour. I hope that this has been helpful. Nervous system regulation, again, it's often a really big piece that's overlooked. We are often going after the more tangible things like the food and the gut microbiota stuff, like around SIBO or like bacterial overgrowth or dysbiosis things, candida, right? They're all really attractive because they feel more tangible. Like we just can treat them with something, or we can remove the food. But in having worked with hundreds of patients and seen it myself, these tools are usually only temporary fixes, if at all. And the bigger work is really in, like I said, the nervous system support and the building of routines and working on that gut-brain communication piece, which is why I have the talk today, because of how important it is. So I think that's it that I wanted to mention. Please, if you have any questions, please shoot them my way. Thank you to everybody who joined. I don't think I see any questions here. Hang on a second. No questions. Okay. So I'm going to finish up there. And if you do have any questions, though, after the talk, you can always shoot me a DM. I'm happy to answer them there. And I'll probably respond to it in you're so welcome, Ellie. Good to see you. Yeah, I will offer them in a story so that other people can see the answers. So have a wonderful day. Thank you so much for showing up, and we'll see you soon.